I'd like to talk to you about the technology that we use to determine if a patient is a candidate for chiropractic care, and then to gauge our progress as we move along through care. So chiropractic is all about brain-body communication. Our nerve system is what controls all of the functions that happen in our body on a day-to-day basis, tissue healing and regeneration, all of the processes that keep us ticking. And so there is no system that is more important to make sure that is working at 100% than our nerve system. Because of the nature of the nerves at the spinal level, they feel about 10% of what's going on, but 90% of the nerve goes to run the body. So what this means is that pain is not a great indicator of how well our nerves are working. So we have to have some sort of technology that allows us then to look underneath the surface and see what's going on with this system. So we use a technology called the Insight Millennium that uses EMG and thermal to determine how well nerves are working at each neurological level. And this is part of the scan results to help you get the idea about what we're looking at. So the results give us the patient with each neurological level, and what we're looking for here is for each area to be clear, which is indicated by the white. This is a nerve that's working well, and our brain-body communication then can be at 100% at this level. Then you can see with this patient here, we have some that have some color, and that goes from green, which is mild, to moderate and severe at the red level. And then this patient even has some black, which are off the charts there. And this tells us that the patient is certainly experiencing some distress, and this is clearly a candidate for chiropractic care. This particular patient's story is that she was dealing with fibromyalgia and low energy levels, along with some other symptoms related to her neck and shoulders. And so we started chiropractic care with this patient, beginning with Atlas C1 and working in the rest of the spine from there once that area was stabilized. Through the course of about a month or 3 months or so, once a quarter, we check in and see how things are doing. This is where the patient was able to return to. And so you can see the progress here. It's some pretty obvious progress there. Patient still struggling a little bit in this upper cervical region, but a number of areas that have then cleared and are working better for her. And this is what we want for all of our patients. We use this scanning technology to make sure that we are affecting the body in the way that we want to. And the technology is designed to use all the way from newborn infants to patients in their golden years. I really like the technology because it gives us a clear picture about things that we can't really quantify in any other way. One of my favorite recent stories is of a patient, a lady who came in, and she was having bladder infections again and again and again, and she'd been through a number of courses of antibiotics. She had changed her diet, she had started a supplement protocol, and it would help for a little bit, but then never resolved the issue for her. And she was at the point where she had been recommended continual antibiotics with no end in sight, perhaps a lifetime prescription for her. And so she was just really looking at what are my other options here. And we completed this scan for her to find out if this had any implication in what was happening. And we found that at the neurological levels that control into bladder, lower digestive, reproductive organs, that she was under tremendous distress there. The red and the black, and the interesting thing for her was this did come as a surprise because she wasn't feeling any pain in her low back. but that's the nature of these nerves here and why we do the scan. So this story has a happy ending because as we were able to begin working and clearing up some of this stress for her, then she was able to have a resolution in her symptoms. And it was a little bit of further medical testing that told us that she was actually having trouble completely emptying her bladder because of the nerve control issues there, which was creating just a great petri dish for all of the bacteria to continue to multiply. So this was life-changing for her, and we find that with many of our patients that looking underneath the surface at the control system of the body is key to their health. So we encourage everyone to have a scan. If you haven't had one of these before, then we invite you into the office for the scan. It can be a real eye-opener, and many of our patients find that it puts together some pieces of their health puzzle that are life-changing and just such an increase in their health that is seen once those areas are resolved and their brain-body communication is then working the way that it's designed to. So we invite you into the office. We'd love to do a scan for you.